So today I was at CrossFit and trying to be awesome, decided to max out during my WOD. It was a deadlift day and I was able to lift about 205 pounds, not bad, but I was also being beaten by the rest of the class. Most of the guys were pushing about 300 pounds, and there was even one chick that was super buff that was doing 215 pounds as a deadlift. So I had to show up. So I did my 205. I was trying to do a max out, indirectly pulled my back. That is the not so proud moment of my CrossFit escapade, but overall, still proud of myself. And it's been about 3 weeks since I've been in it. But the downside is I have a toddler who's extremely jealous. He's currently 3 years old, weighs about 35 pounds, and with a sore back, he feels like 100 pounds. And he's super jealous because I have a 4-month-old, which I carry all the time, and it's an ordeal that we're dealing with. So I figured this be a perfect launch pad on figuring out how to manage back pain, the cardinal signs, red flag signs, and just some simple management tips to get you better. So now that you have some context, I'll share my medical way of managing back pain. I will also explain potential concerns you need to be aware of with back pain and danger signs, which I call red flags. So let's dive in. Usually, if you take a good history from a patient, you can determine the cause of the back pain. In this case, mine was overuse. I lifted too much, probably had a crappy form as the workout continued and aggravated my back. Knowing that I did not have the danger signs of back pain, I decided to treat the issue. The one thing you should not do is stay idle and rest. Most people think you should rest your back. However, this has been shown to delay healing, cause further immobility, and further frustration to the patient. I do recommend to my patients to continue doing light exercise, still being active. Obviously, don't lift anything heavier. I put a recommendation of 10 pounds. Also take some Tylenol, some ibuprofen to help with pain control, relax the muscle. I also use heating pads to also help reduce the tension in the back. Do back stretches, and continue to do the things you like walking, cycling. Avoid heavy weights, obviously, for now. This strategy is way better than just telling patients to sit or lay down for a week. Take pain meds and you will be better. Not the case in this situation. Okay, so I mentioned some danger signs. So what are these red flags? What does it mean? If somebody presented with tingling or electrical numbness down the leg, this could be a potential spinal cord compression issue that needs to be managed immediately. A detailed physical exam and a possible MRI should be used to determine the cause. A common condition is called sciatica. This is compression of the sciatic nerve that runs along the butt, and you can feel numbness along the butt, going down the back of the leg. And this is because of pinching of the nerve or slight compression. More severe conditions to the nerves can happen, and that needs to be worked up and thoroughly managed very effectively and quickly. Another danger sign is, say the patient reports fever, they look sick, and reported back pain. The doctor should be suspicious of a potential spinal infection. This needs to be treated immediately, or the patient can have spread of infection very quickly to the brain, leading to coma and death. Another big red flag for me is if the patient had a history of cancer. Prostate, breast, and kidney cancer all metastasize to the bone. So if a person has back pain that's acute and a history of cancer, I'm looking for, hey, do they have spread of cancer into their spine? Is it causing weakness of the bone, causing pain, compression of the nerves? Again, emergent issue because the bone is brittle and weak, and severe compression fractures can occur, causing permanent and traumatic damage to the spinal cord, leading to potential paralysis. Lastly, general clinical guidelines are, if you do not improve with conservative measures in about 4 weeks, I usually order some form of X-ray, MRI, or etc. You can do a variety of images, but the best is MRI. It allows you to see the spinal cord in full detail. X-rays just give you anatomical alignment of the bone, make sure there's no obvious chips or fractures, but you don't get any real definitive imaging of the spinal cord. A CT scan is good for bone health, evaluation if there's an abscess or infection developing, and you can also pick up if there's cancerous process occurring to the bone. Once again, thanks for watching. New videos post Wednesday and Sunday. Click the like button, subscribe, and if you have any questions to ask the doc, comment below. Thanks again.